Some of their rights and freedoms have been taken away by law. Even so, they have to be treated with respect, dignity, and value like any other human being. And the high walls of the correctional facilities never stand between them and health services. In Zambia, inmates have not been left out in the fight against the HIV and AIDS epidemic.
Doesn't mean that you are not a human being. We are inmates, but we are human beings. So that is why the government has put it mandatory for one to have access. That is, an inmate to have access, same as those people outside, so as to maintain the good health of inmates. And being an inmate is not the end of the road anyway. One will complete the sentence, will go and integrate with other people.
The National AIDS Council, with a mandate to coordinate a multi-sectoral response to HIV and AIDS, says that no one has a right to be infected, and inmates too have the right to know their status.
Nobody has the right to be HIV infected. Everybody has the right to be, to protect themselves. And even if they are incarcerated, they are still human beings that must know their HIV status.
3,333 inmates are living with HIV in Zambia, out of an inmate population of 20,485 as of 30th November 2020. However, the Zambia Correctional Service says that the current number of inmates living with HIV in the correctional facilities is a positive indicator in combating the epidemic. Elizabeth Muchinda is the HIV focal point person in the Zambia Correctional Service.
Done quite a lot in the past 10 years because the HIV prevalence in Zambia Correctional Service, according to our daily count, it's about, as of today, it's like 3,333 out of population of 20,000. We've reduced from 27 to approximately 15%.
The reduction in the prevalence rate from 27% to approximately 15% over a period of 10 years is attributed to the efforts of cooperating partners working with government through the Zambia Correctional Service. The partners, known as the Prisons Health Advisory Committee, PAC, collectively work together towards improving the health and social welfare of inmates. Kelvin Ngoma, a member of PAC, says the committee is committed to the welfare of inmates. This was during the World AIDS Day commemorations at Mwembeshi Maximum Security Correction Facility in Chilanga District.
These PAC members contribute in several ways towards improving the health status of inmates, including reducing new HIV infection and mitigating the impact of HIV among prison inmates and defined prison communities.
Upon admission, inmates undergo a screening process, including testing for HIV and AIDS with consent of the inmate.
First thing, we subject them to education about HIV. We'll ask them if they have ever heard of HIV. Then if they have, then we'll take them through what HIV is and what they need to know about HIV. And we ensure that every inmate gets full information, and we allow them to ask questions. Then thereafter, we're able to assess and know that, okay, this client is now fit. It's them themselves who even opt to do an HIV test after getting the information.
The future is our responsibility. Let us take action now is the theme for this year's World AIDS Day commemorations. Dr. Chisela Chileshe, a medical doctor by profession and Commissioner General of the Zambia Correctional Service, says taking responsibility is testing for HIV and AIDS now.
All what we need is the responsibility to extend our fingers or whatever for them to extract just a drop of blood, for them to know and for us to know where we are standing in terms of our status. Now, it only takes a drop of blood to save life.
Rule number 24 of the Standard Minimum Rules for the Treatment of Prisoners dictates that prisoners should enjoy the same standard of health care that are in the community. free of charge without discrimination on grounds of their legal status.
We have got this Mandela rule pertaining health. That rule doesn't only work in South Africa or any other countries, but here in Zambia, it is also applied and it is being followed correctly, and no one is left out in terms of health.
To be in prison results in the loss of certain rights and freedoms. But the access to basic needs such as health, food, and shelter remain inseparable from any human being, even in prison. Reporting, I am Luhano Mwangweo, The Detail.